Okay, so welcome ADHD Without the Shame from Diagnosis to Empowerment. We are Cognito Health, and I'm joined by a group of my colleagues today, which I'll introduce here in a moment. Um, First, we need to just kind of go over what this session is and what it isn't. Um, and we can do that with a little bit of a disclaimer as well. So, uh, the information that is shared in this webinar is for general educational and informational purposes only. It's not medical advice, a diagnosis, or a treatment plan, and it is not a substitute for professional care from a licensed healthcare provider. By attending or submitting questions, you are not entering into a therapeutic relationship with Cognito Health or any of the presenters today. And by continuing to attend, you acknowledge and accept this disclaimer. If you prefer not to, you can simply leave by the leave meeting button in the bottom of your screen, but we do hope you'll stay. And finally, if you are in a crisis or need immediate support, please contact your local emergency services or a trusted mental health care professional right away. So I am pleased to be joined by my colleagues here today. Uh, I am Anna Spilker, CBT team lead and a CBT care provider for Cognito Health. I'm joined by Francesca Teest, who is our nurse practitioner and a diagnostic practitioner here at Cognito Health, as well as Caitlin Colin, a CBT care provider and an ADHD coach. As well, we are joined by a former Cognito client, Trevor White, who is here to share his kind of lived experience with the ADHD diagnostic process and adult ADHD. We've also got Armand joining us to moderate the chat there. So thank you all for joining us. For those of you who are new to Cognito Health, we are an all-in-one virtual mental health platform, and we operate in BC and Ontario at this time, and we support individuals 17 and up who are experiencing mild to moderate anxiety, depression, insomnia, or ADHD. We believe in high-quality mental health care and that it should be accessible, affordable, and immediate. We've worked with thousands of clients, and we are on a mission to bring clarity and compassion to the mental health care system in Canada. Our all-in-one service means that we work from a team-based approach. So we've got our medical providers and our therapeutic providers. We have psychiatry oversight, and we bring it all in-house so our clients can get the diagnostic testing, access to medication, one-to-one CBT skills therapy, and group therapy, all from the comfort of their home. So that's a little bit about Cognito and who we are. And next, I'm going to just share a bit about how this webinar came to be and why this conversation really matters. So we identified a need in our client base and beyond for more clarity around adult ADHD specifically, how it's diagnosed, what treatment options are available, and also how to navigate the social perception of being diagnosed with ADHD beyond childhood. We noticed that there is some fear and some stigma around these conversations. And so we wanted to just provide that information and provide that platform to have a discussion to break down some of those barriers. And we want today to empower you to feel informed and confident when making decisions about your own ADHD journey, or maybe even if you're supporting someone as well who is going through this process. There's no expectation to pursue a diagnosis, medication, or treatment. Today is simply just about understanding and demystifying this adult ADHD diagnosis process. So without further ado, I'm going to pass it over to Francesca, and she is going to help us kind of clarify what ADHD is, how the diagnostic process works, and then a little bit more about the treatment options available. Take it away, Fran.
Thanks, Anna. So I'm going to set my timer because I start talking and then I can't stop. So I know I should try and stay on track here. So my name's Fran. I'm a nurse practitioner. I work both in primary care as well as with Cognito. And I've just been asked to speak a little bit today about what ADHD is and the diagnostic process for arriving at that diagnosis. So ADHD, as the slide says, is a neurodevelopmental condition that affects executive functioning. So neurodevelopmental just references conditions that arise as the nervous system and brain develop. And so there is definitely a genetic predisposition to developing ADHD. Um, but the important part, I think, with classifying this as a neurodevelopmental condition is that ADHD is not about laziness. It's not about lack of willpower. It actually, people with ADHD's brain has different structure and works differently. And this condition affects executive functioning, which you can see on the diagram there, is that higher level brain functioning of task initiation, completion, attentional control, being adaptable, working memory. All those things are realms that ADHD can impact. So ADHD presents basically in three ways. There's inattentive, which is the more difficult focusing, easily distracted, forgetful, and then the more hyperactive, impulsive. And there's also combined. And so the thing that I appreciate about these three ways of presenting is that it is a continuum. So the combined for me captures even that it can be a bit of hyperactivity as well as inattention, or where on that spectrum clients can be. Next slide. So in terms of demystifying the diagnosis, a few things to think about, and one of them is that adult onset ADHD is a relatively new diagnosis. I mean, we knew that you didn't outgrow childhood ADHD, but having that as a new diagnosis was really only first recognized in 2008, and I think it was in 2013 that guidelines were developed to really help us define and diagnose ADHD. So it's relative new diagnosis. And so I think because of that, when we hear lots about people saying, oh, everyone's got ADHD, I think it's more that it's finally coming out of the woodwork. And so there is a lot of chatter about it because I think a lot of people have been coping with attention dysregulation for a very long time and just haven't had a diagnosis. So in order to be diagnosed, one of the things that other things think about ADHD is that it does fall under the umbrella of clinical diagnosis. So there are some conditions that can be pretty easily verified with the lab test. So we know that if your hemoglobin's low, you have anemia. ADHD is not that straightforward. It's under an umbrella called clinical diagnosis, which means it's a diagnosis that has to be made by qualified professionals. And it's based on a really comprehensive evaluation of symptoms, behavior, history, and putting that all together into a package that then helps us define what ADHD is. We have some guidelines from CADRA and from the DSM that help us organize all that information. And so in order for adult ADHD to be diagnosed, we look for people to have at least 5 core symptoms. These symptoms should have been around or should have been present for at least 6 months. The age of onset, the symptoms should have first been recognized before the age of 12. And the symptoms need to happen in at least 2 different settings. So whether it's home, school, work, with friends or relatives. And having those symptoms is one thing, but do they impair your function? So that's the other important piece is, does it impair function in social, school, or work settings? And once we have all that, we also need to clarify that those symptoms aren't better explained by another condition. So as an example, we know that thyroid dysfunction can really impact how your attention is able to be regulated. Anxiety can play a big part in that. I remember working with a psychiatrist who always said anxious brains have a really difficult time paying attention because they're so busy dealing with the anxiety. So we need to really be able to pull all that information together to come up with a diagnosis. So in terms of what happens with Cognito, when clients first sign up for the diagnostic process, you'll usually get sent quite an extensive list of questionnaires. And we recognize that those can be pretty hard to complete when your attention is dysregulated. So we do have a navigator with Cognito that can help with that. All of that information is then put together so you can have a meeting with the nurse who really organizes all the information, and then you'll have another lengthier appointment with the nurse practitioner to go through all that information, put all the pieces together to arrive at a diagnosis. If your diagnosis is positive, we do offer a combination of treatments. Medication, we know that long-acting stimulants are one of the best treatments for ADHD, and that includes things like Vyvanse and Concerta that we'll talk lots more about once we get to the point of needing medication. Two big things that I want to point out under this is that medication for some patients, it can be the first dose is the magic dose and it just changes their life. But for a lot of patients, it can be a bit of a journey. So it's being patient to recognize that we need to try different medications. You may need to look at different scheduling options. There's lots of parts of that journey that can take a while to get to the right dose that is right for you. The other huge important piece that I know that Caitlin's going to talk more about, but it's what brought me to Cognito as a provider too, is CBT therapy is so important. Because it's a lot about recognizing how your brain works, the tricks your brain plays on you when you have attention dysregulation, and how do you change that um, in order to really maximize your attention. So we prescribe the medications, but I really encourage people to access CBT therapy as well. Not everybody that we see will have an ADHD diagnosis. Sometimes it can be, it's a bit equivocal whether that's really the diagnosis. And so we're really lucky that we have psychiatrists on staff that we can consult with to see, is this fitting? Is this where we should be going? And for some people, it becomes evident that it's not ADHD that is really the presenting concern, it's something else. If it's anxiety and depression, Cognito can offer a lot of support with that too, with CBT and medication. And if it's something that's beyond our scope to be able to assist with, we try our best to be able to link you with some other sources of treatment and help.
Awesome.
And I think
Thank you,
that's it.
Fran.
You're welcome.
Sorry about the slide arrangement there. I
That's
think
okay.
I clicked a little too fast. Well, we appreciate that, and I know you're going to answer a few more questions later on as well. If other of you or other people who are listening, if you have more questions about this kind of the medical part of the diagnosis process, we are going to break that down further post webinar on our blog. So now I want to pass it over to Caitlin, and she is going to help answer some of these other questions that many of you have.
Thanks, Anna. Hello, everyone. My name is Caitlin. I'm a CBT care provider here at Cognito, and I work with a lot of adults who have ADHD, and for a lot of them that were just recently diagnosed. So to start off, I think it's helpful to kind of reiterate from a different lens why so many adults are questioning ADHD right now. And I think it's interesting that for a lot of us, ADHD was absolutely never on our radar growing up, as a lot of people don't actually fit that kind of like hyperactive stereotype that many of us associate with ADHD in kids. So there might have not been any obvious red flags when it came to grades or maybe relationships or school in general. So the adults in our life might have not had those obvious indicators that, okay, maybe something else is going on that they need support with. And ADHD presents quite differently person to person, like say within little boys and little girls. So sometimes it goes unnoticed. And it's often not until entering the adult world that things start to feel a lot more challenging. Suddenly gone are the days of all these like rules and all this structure, people setting schedules for us and due dates and managing everything. And that's when a lot of people start to notice challenges. It can look like maybe starting a whole bunch of tasks and somehow getting none of them done. Maybe procrastinating things that you actually really care about. It can even look like zoning in and out of conversations, maybe even this presentation, even forgetting answers to questions that you've asked 6 times in a row. And with this awareness through social media now, us having so much more access to information, a lot of people are seeing themselves reflected in ADHD in a way they never quite noticed. So this can start to shift from really self-critical thoughts about ourself, our character, and our worth ethic to kind of considering for this first time, like, okay, is there actually more going on here? And we can go to the next slide there. So with that, for a lot of people who grew up with ADHD and not knowing, we can internalize a lot of shame because we didn't have that understanding around how our brain might work differently. And we might hear from the outside world a lot of narratives around, you're so capable, you're just not applying yourself. Or yeah, like a lot of shame narratives. So for a lot of us, we internalize that as a way to function. So our internal voice might start to sound like, why are you sitting down? You're being so lazy. You should be doing more. It's not that hard. Just do it. Everybody else can handle this. And for a long time, that can become the strategy, basically berating yourself to get things done because the other strategies aren't quite cutting. But over time, that's not only exhausting, but it can have a really negative impact on your mental health. And I think to reiterate from earlier from Fran, ADHD is not about laziness. It's a brain-based difference that really impacts how you regulate your attention, your motivation, your emotion, and your energy. So it directly affects your ability to start tasks, stay focused, follow through, and even on things that you really care about. So when people start learning that, it can really shift the relationship they have with themselves and that internal voice. But it's definitely a process to get there. So when people start questioning, like, okay, what if this is ADHD? Sometimes there's also a fear. It's like, okay, am I just looking for an excuse? And I really want to normalize that this is something I hear all the time, even honestly from people who do have a positive diagnosis. It's like, what if I'm making it up? What if I'm actually just lazy? And that doubt is a really common part of the process. And going to the next slide, it's definitely an emotional roller coaster before, during, and after assessment and diagnosis. And I think this is something that we don't always expect heading into it, that it's quite the emotional whirlwind. Before diagnosis, like I was talking about before, there can be so many like encouraging moments of understanding yourself deeper and kind of healing some self-compassion as well. But there's also a lot of fear in different flavors. Like, first off, fear, what if it's not confirmed? Like, what if I go through all of this, all the forms, all the appointments, all the hope, and then I still don't have answers? And on the other hand, there can also be fear, like, okay, what if it actually is confirmed and that feels very real and permanent somehow? Then during the process, there are often so many moments of validation, even just being asked the assessment questions. In our heads, it's like, wow, these are standardized questions. Like, other people experience these same things. But also, it can be quite overwhelming with, again, all of the forms and appointments that we complete. And then after diagnosis, it's still the roller coaster. You guessed it. So first off, there's a lot of relief and validation. Like, okay, there's a reason things have felt this hard. But alongside that, it's often a big chapter of grief, kind of looking back, wondering what might have been different if you would have known earlier, or what support you might have needed and didn't get. So it becomes this process of kind of re-understanding your past and getting to know yourself on a deeper level. So that's quite the mix of relief and grief, but it's very normal. And from there, when it comes to support, medication is definitely one tool, but it's not the only tool. As Fran mentioned, research really shows that it can be a very effective approach to have both medication and other skills and support kind of working together in tandem. But for a lot of people, yeah, they aren't wanting to explore medication, which is fair, or some people on medication don't want to be on it long term. It's very complicated how people kind of want to approach support long term, but thankfully, there's a lot of avenues you can explore. And first off, psychoeducation and skill building is huge, learning how your brain actually works, building skills that are actually designed for your brain, not designed to change it, if that makes sense. Also, skills around support with emotional regulation, executive functioning strategies, creating systems and environments that support you instead of work against you. And also, lifestyle adjustments that really support your energy and focus can be life-changing. And beyond that, I think something that we don't always talk about is that the connection and community piece is huge, whether it's therapy, support systems, finding communities of like-minded people or like-brained people, I guess. And just having people to talk to who can understand is also life-changing because a lot of people have been trying to force themselves into strategies that were never designed for them. And when support is actually aligned with how your brain works, things start to feel a lot more doable. And I think having that support along the way makes a massive difference. And from there, from diagnosis to empowerment, I think first it's really helpful to disclaim that ADHD does not define you. It may be a part of your experience, but it doesn't actually change who you are as a person if you get that positive diagnosis. So for many people, getting a diagnosis later in life is sometimes the first time they're starting to get to know themselves without all of the masking. So there's this process of building self-awareness and understanding and figuring out how your brain works, what you need, what actually helps. And I think one of the biggest pieces is actually having the language to describe your experience, because when you can understand it, you can communicate it. So this has a massive impact on relationships, being able to set expectations and actually advocate for yourself. So I think it's really helpful to kind of highlight this and also highlight the strengths or superpowers of ADHD minds. I work with a really diverse group of people. And honestly, adults with ADHD are some of my absolute favorite people to work with. Their brains are so sparkly, and oftentimes they're such out of the box thinkers. And honestly, they're kind of the creatives and innovators in our communities. So I think we don't always talk enough about like the strengths of the ADHD mind. And it's cool with a diagnosis how people are able to kind of lean into that. So yeah, the goal isn't to change who you are, more so understand your brain, work with it, and build a life that actually supports you and leads into those strengths. And with that, I guess I'm passing it over to Trevor to kind of talk about his personal experiences with the Cognito assessment process and life beyond diagnosis.
Thank you, Caitlin.
Yeah, well, yeah, thank you so much, Caitlin. And it's funny to hear you go through the motions of the pre, during, and post, and really feel so validated in that experience once again. So yeah, I really want to share my experience of being diagnosed with ADHD, really starting from like my pre-diagnosis. So I think that it's really important for people to understand that it like whatever has incentivized you to potentially go and get any sort of diagnostic, and especially the one with Cognito, I found that it was an effort for me to get to know myself better. Where I was at a pre-diagnosis, I was getting into situations that maybe weren't always working for me. So, I was really struggling to move from task to task. And I also was finding that there was conflict in my like personal life that I didn't really understand would arise or were continuing to arise over and over. So, something that I now know, but maybe we can talk about it from a pre-diagnosis standpoint, is that I'm being measured with your intentions versus your actions. So, someone who may be a bit more neuronormative would be want to be judged by their actions, whereas someone who like has ADHD really wants to look at their intentions as well. So there would be intentions to get something done around the home, and it maybe didn't get done, but I want to be recognized on those intentions. So understanding that conflict between my partner who is more neuronormative, I should say, or maybe that's the wrong classification. But for myself who has ADHD, there would often be some conflict because there wasn't any dialogue around it. I know it doesn't really say on the screen, but just want to talk about personally my diagnostic experience was extremely personalized despite being virtual. People came and met me where I was at. And also, people did come check in on me. So not only could you get text messages or emails saying like, "Hey, this specific form And I know it can feel really overwhelming, regardless of who you are, to fill out 5 to 10. I can't quite recall how many forms there were, but it does feel a bit overwhelming at the beginning. We're going through this process emotionally. And so for someone to kind of just give that like accountability nudge, and give me a phone call or give me a text message that has my name in it, it really felt like it was a really special, like, hey, I know where you're probably at. So that was a really wonderful experience with it. I was diagnosed last year, so I'm still pretty new in my ADHD experience. But what I do want to share is what I was able to understand about my post-diagnosis. So I was diagnosed with a combined ADHD, so both on that hyperactivity as well as that inactivity. And I think as Caitlin showed and shared, and as well as Francesca, what really ends up happening is like that shows up so differently for everyone. So, as a child, I think I had really stereotypical symptoms of ADHD. I didn't want to stay in my seat. I couldn't help myself to talk to people. But when it comes to where I was in my post-university life, I was very determined. I like to try different things very, very quickly. And I think about that as my superpower, is that I wanted to. I've been really well known in my career to be a generalist because I want to learn everything very, very fast. At the same time, with that, it was really validating in my post-diagnosis to be like, I am who I am, and I've been successful because of who I am. So when I think about that, that was really, really helpful for me. Um, and then when I think about the challenges of my post-diagnosis, is I kind of like got that shame a bit again. And what I want to share about my post-diagnosis shame is that, like, oh no, no, like now someone has clinically validated, and this is Trevor's internal brain saying something is wrong with me. And it's not that something is wrong with me, it's that I am different. And why I'm different makes me extremely special. But I want to talk about those challenges of like, yeah, I was like a bit glum of like, like viewed myself as a high achiever. I thought I like had it all figured out. And now I had this new wrinkle in my life that I had to like start navigating. So even though that was my full intention where I started, it was, in hindsight, a bit comical that I actually was, experiencing some shame and some grief about like, how do I, how do I figure this out? And then the last thing I want to share is like, when you get to share your diagnosis with the people around you that you love, they also take it upon themselves to learn. So I recall maybe one of the first 2 days getting home and talking to my wife about my diagnosis. And she is on the internet being like, oh my gosh, this completely makes sense. Like, this is why you do what you do. And, to have a partner that was exhibiting that curiosity was really, really special to me. And it really incentivized me eventually to like go down my own research. Um, so yeah, when it comes to our coping and treatment, I think this is a really interesting place to be. So I'm going to share a bit about my timeline with my coping strategy, and I will then talk about where my timeline looked within that. So I took a beat when I first got diagnosed. I said, you know what? I was talking to my nurse practitioner, and she said that I have great coping strategies. I have parameters in place to still exist in this world as it stands. So I decided to not do anything different. I was already doing therapy, not with a therapist that either was specializing in CBT or had a lot of ADHD clients. But I said, we have a good thing going. Let's stay. I'm not going to take medication. I've existed in this world for 30 years. And I thought it would be time just to say like, okay, this is a path that I've learned a bit about myself. As time went on, as I was learning more, I realized that I probably wanted to move to a care team that had a better understanding of CBT skills as well as ADHD. So, moving forward into late 2025 and early 2026, I moved to a care team that could better understand me and what I was going through. And I was really proud to go into those conversations and say, like, hey, like, I'm killing it. My career's going well, but I'm exhausted. I am very, very tired. And that was the first moment where I had someone who also had ADHD say, like, hey, you bouncing from task to task to task, and then you going home to your family after is actually way more brain work than it might take someone who doesn't have ADHD. And that was the moment that they said, hey, like, you might just be able to be less tired if you take medication. And that was a really big unlock for me that I was able to understand, okay, now I know a bit more about myself. I've now found the right care team to help me, and let's now introduce medication as that could be the potentially right thing for me. So what we did is we did start on medication, and I will say that like my energy levels, my ability to like not get burnt out on tasks that involve transitions was profound. Like, and Francesca alluded to it as well with what medication looks like for each person. But medication's changed my life. It's made every relationship in my life better because I don't get to the end of my day and want to just like lay on the couch and, watch absolute trash TV. I can be present for the people that I care about most and not necessarily sacrifice my like cognitive effort, changing from one meeting on one topic to another meeting on a different one. But I really had some hesitancy because I thought to myself, hey, I can do this. I have been doing this. Why don't I keep doing this? And really, really unraveling what that was, which was probably shame of taking medication to function, really was a massive unlock. And obviously my opinions changed, but overall, that was my experience. It's been a really beautiful one, but I do really, really hope that people like think about their timeline on a post-diagnosis and coping side looks completely different, but this was just my personal journey through ADHD.
Awesome. Thank you, Trevor. It can be really validating for people to hear from those who have real life experience. So I really appreciate you joining and sharing today. And I think you articulated really well that it can look so different for everyone, and even different than what you thought it was going to look like when you started the journey. So I really appreciate your perspective. Thank you. Okay, so now we're going to move to our Q&A. Thank you to everyone who submitted questions prior to the webinar. I wish we had time to address them all, but we want to make kind of a good use of our time here today with our panelists. So we've got a couple questions selected to answer live here. And then I'm hoping that I can take all the other questions that you asked. There was a lot of overlap, so I can group them together. And as a team, we can answer them through a blog post. Cognito has a blog that our CBT care providers and our medical providers develop together, and we write on lots of different mental health topics. So you can check out our blog anytime to read more about these things. It's getcognito.ca/blog. But yeah, I'm hoping that in the next couple of weeks or the next week, I can answer all your questions because I know you have lots and it is important to get those answers from the professionals. But for now, we are going to move over to Fran, and she's going to answer a couple questions that came up once or twice, but I think are really important to touch on. So thank you, Fran.
Thanks, Anna. So two of the questions that had been posed to me were ADHD in the context of autism spectrum disorder because they're both neurodevelopmental conditions. And so I think that it's very individual, so very difficult to answer that question just in the general. I think that once we start looking at multiple neurodevelopmental conditions, it becomes much more of a specialist kind of issue. And so I think that would warrant having, it's difficult to get an assessment for autism spectrum disorder as an adult. There are There are more psychiatrists who are starting to do that. And so that would be the next step, is being able to connect you with the specialist that can help with that issue. And then the other question is around menopause and cognitive decline, which is a fascinating question. I think that with adult ADHD having now been, I guess legitimized might not be the right word, but I think it's opened the door to all sorts of other research opportunities. And I think there's a lot of work going on in looking at how does menopause and cognitive decline impact, does ADHD impact those, and do those impact ADHD? So there's still a lot of emerging literature about that. I did attend a webinar yesterday that talked about menopause, because we also know that ADHD as an adult can sometimes be you've coped until situations arise that you are no longer able to cope with, which is where people come in when they're wanting that diagnosis. And so we know that estrogen does have a protective function in terms of being able to regulate executive function. And so it does look like menopause can impact attention regulation. And so I think there's going to be a lot of research coming out in some of these areas. The things that gets a little bit trickier too is as we age, it's a bit more difficult sometimes to prescribe stimulants. And so that's another area that was listed as something that's going to be a lot of emerging research coming up. So I think it's an interesting time to be in ADHD and aging as well. I can say that with my gray hair.
Thanks, Fran. Yeah, lots of complex uh, avenues of ADHD and overlapping in different directions here with aging and other disorders. So it's great to hear from a professional who sees this and deals with this every day in your job. And yeah, thank you for continuing to learn about those topics as well, so that you can share with us as you learn. Okay, I'm going to throw it to Caitlin now. She's got a couple questions she's going to answer for you.
Thanks, Anna. So my questions, first off, how can someone with ADHD work through avoidance or procrastination? There is a lot you can do for like these challenges, a lot you can do outside of medication, especially with cognitive behavioral therapy. Looking at different tools that work, say, with like thoughts or more like internal obstacles, or kind of working with your environment and external obstacles. We don't really have enough time for me to go into everything, but if I could give you one main takeaway, I would really stress systems over willpower. Willpower is a very, very limited resource, and with ADHD, it's even less reliable. So instead of trying to just like try harder, I really encourage you thinking about systems external to you that you may be able to set up so that you can rely on those. So like say really simple ones might be making important things more visible or reducing distractions in your environment. Things, yeah, like really trying to get some of that executive functioning off of your brain and onto systems in your life can honestly be life-changing. So yeah, I guess main takeaway is systems over willpower, which I know can sometimes be a hard argument because I think willpower and like discipline are very celebrated things in our world. But yeah, it's food for thought, I guess. And lastly, why are so many women being diagnosed with ADHD later in life? I feel like Fran's kind of covered a lot of this. There's a lot of emerging research, more specifically around like women with ADHD and how it might show up or present slightly differently. Kind of like I was talking about earlier, a lot of women didn't fit the stereotype of ADHD that, say, like adults, like teachers, parents might have historically looked for, kind of those like glaringly obvious external red flags. So things like being disruptive in class, having a hard time with relationships, or things like grades. But the more inattentive or internal challenges like zoning out or overthinking or maybe feeling really overwhelmed, those can sometimes be more easily masked. It doesn't make them any less challenging, but like the masking can play a big role in kids getting diagnosed. So somebody externally might present as very like high achieving or organized, but often it takes like a huge amount of effort to kind of like maintain that mask. So those struggles can be missed or maybe explained by perfectionism or anxiety or maybe even just like personality. And often it's not until adulthood, when those demands may shift and those coping mechanisms are either like unsustainable or they're not quite cutting it anymore, which is when people may begin questioning ADHD, if that makes sense.
It does. Thank you, Caitlin. Yeah, I think that topic of sort of masking and dealing with those internal struggles, especially when you're a child, you don't have the language, you don't know how to express what's going on for you, and then it can get missed, and especially with girls. Yeah, so we find later in life a lot of women are being diagnosed, and it's important to just recognize that that's just a difference, right? It doesn't mean one thing or another about ADHD in men and women. It's just a difference and just a reality. And yeah, okay, thank you, Caitlin. Okay, I'm going to pass it over to Trevor, and he's got a couple questions here that he will answer for you as well.
Yeah, the first one, what ways do you find most effective to live with ADHD? For me, I think it's really how I structure my day with ADHD. I'm lucky enough to be an entrepreneur, so not necessarily like bewildered to, attending a workplace every single day. So I think really the most effective thing I find is leaving. I set up my day into non dopamine hit type items and really high dopamine hit, and I find that my effectiveness and what I do is really, really strong in the morning. So I will do as much as I possibly can in the morning, and then I will try to do all of those like fun, high dopamine items in the afternoon. So that is like one thing that I've been able to do. That really like wraps into the next one when we talk about challenges or wins. But really, the challenges and wins that ADHD has on my employment is like my hyperactivity is one area that I really like. So one thing I've really noticed is that with the topic I'm very excited about, I can find out very, very quickly on whether or not it's something my organization that we've built can pursue. So I really like that I'm able to use and recognize what my superpowers are that that can help me get our organization to where it needs to be. As for the challenges, I'm going to go back to dopamine for a second. So there are things that I will naturally avoid. And once again, working for myself, I think that ADHD, as we talked about, lots of creators, innovators, I will actively avoid things that I don't find fun. And I noticed this in the workplace before I was working for myself. And it would often, and it still does get me in trouble. So I will actively, avoid things that aren't stimulating enough for me. And that's where that like inactivity, or I like to think about it as like avoidant, that if it's not interesting to me, I won't do it, but it's necessary. So I'm really trying to work really hard with my care team to reframe what those things look like. And we joke around calling it like paying off business debt or paying off like, student loans or anything like that. And so thinking of some of these smaller compliance, more mundane things like that. So big challenge. And, I've seen this like with some of my other friends who've been diagnosed with ADHD as well, is that, yeah, that avoidance side of things that just don't tickle the brain in the right way is always going to be a challenge for you. It doesn't mean those things don't need to be done. It's just those are going to take a lot more effort. And trying to find the right way for it is totally as unique as the person themselves.
Awesome. Thank you, Trevor. I think, yeah, all three of you touched on that part about you got to work with your brain, not against it. And so that is so much about the psychoeducation, the skill building, this through CBT, and finding the right medication too. These are all approaches to find the ways that your brain has the least resistance, right? How we gotta keep moving forward, but how can we find the path of least resistance? So thank you all for answering those questions and sharing those important points. So that concludes our webinar for today. We really appreciate you joining. And wherever you are in your ADHD journey, or whether you're supporting someone who has adult ADHD, I hope you feel more clear and confident speaking about it, researching it, making decisions, and ultimately finding the support that you may need. If you'd like, we do have some free self-assessments. They're kind of clinically validated by our psychiatry team. So they help you to kind of determine whether your symptoms are aligned with something like ADHD. We also have one for anxiety, depression, and insomnia. So you can follow that QR code on the page here to our website to take any of those self-assessments. And as well, if you want to know more about how our team can maybe help you along your ADHD journey, we do also offer free discovery sessions. So if you follow this QR code here, you'll book an appointment with one of us, probably from our CBT team, and then we can kind of give you that rundown of, okay, here's exactly what we do, here's how we can help you, this is what you'd expect, and answer any of those other questions that you might have. So I'll leave this screen up here for a moment. You can take a picture of those QR codes as well. They will be coming in the email follow-up. We'll also be sending out some free goodies along with the recording of this session. So please watch your email for that. And if you don't receive an email, you can reach out to me at anna@getcognito.ca. And yeah, we just want to thank you all. We hope this was informative and helpful. Thank you to our presenters today. You each come with a unique perspective and knowledge base, and we really appreciate you sharing that with us. And thank you to Armand for jumping in the chat. All right. We hope you have a wonderful rest of your week, and just keep praying for that spring sun. I know we're all ready for it. All right. Thanks, everyone. Take care. Have a great afternoon.